Building Chair Eshoo and Ranking Member Guthrie and our incredibly distinguished panel of witnesses today. Even before the onset of COVID-19, we were facing multiple crises in our rural health systems, especially in my district in South Central and Southwestern Pennsylvania. Shortages of physicians, nurses, physical therapists, occupational therapists, other health professionals limited what services were available and often would force patients to travel to Pittsburgh or even to Philadelphia for care. COVID-19 has only further stressed a workforce that was already in crisis. Burnout has contributed to an uptick in retirements and providers leaving the field. These have had negative impacts on staffing, and especially in these rural communities. In my community, at health facilities like Wimber Hospital and Excella Health, they've been forced to contract with nursing agencies that sometimes double, even quadruple the cost or hourly rates, just to stay operational and staffed to be able to take care of post-op patients. A misguided vaccine mandate that makes no attempt to account for natural immunity is also driving more and more long and committed professionals out of their fields. This path that we are on is not sustainable and will not result in better patient outcomes for the long term. In order to address parts of this crisis, I worked to introduce the Enhancing Community Health Workforce Act that would reauthorize funding for community health workers to help improve the care coordination in underserved communities. Mr. Levine and then Ms. Harrison, what impact do you think a bill like this could have, especially in rural settings? And I'll ask Mr. Levine to answer first.
Well, thank you, sir. We are actively using community health workers now in several programs that we've implemented throughout the region as a health improvement organization. One of the things that we're focused on is, as I mentioned earlier, avoiding hospitalization. So we identify social determinant issues. It could be anything from somebody who's homeless or can't afford their medications. We deploy our community health workers to assist them. So anything that's done to enhance and solidify their role in the system, I think would be very positive, and we would strongly support it. And I applaud you on your statement about the contract nursing agencies. What they're doing is not only financially destroying some of these hospitals, but they're also distorting the market for nurses, and it's not helpful what they're doing.
Thank you for your answer. Ms. Harrison, would you please address the same?
Thank you. Yes, sir. So I'm not as familiar with the particular program, but recognize the importance of any bill that gets more opportunities to work with community health workers at the local level, especially in rural areas. We do work with local community health workers, and they've been wonderful, especially these last few months. I think it's important to note that the intent of the grants do seem really helpful in that they're disease agnostic. So much of the funding that comes to us is very specific. And so I can appreciate what I understand is true about that level of flexibility to address healthcare needs that might vary community by community. Certainly COVID funds are critical to address COVID, and there are also many other public health issues that still will need to be addressed moving forward. So hopefully, one program will not be accountable to the other. I think we need them all.
And do community healthcare workers provide that ubiquitous care that is so necessary?
Yes, and originally also public health workers were our original community health workers. We definitely need both.
Thank you. Mr. Levine, in your testimony, you spoke at length regarding workforce shortage issues. And I've heard from several people who run health systems in my district of the challenges of maintaining a workforce, especially in this economic climate. What should we be doing as policymakers to ensure that rural healthcare workers want to stay in these critical roles?
Well, one of the first things that's really has disadvantaged rural hospitals and non-urban hospitals throughout America has been the Medicare Area Wage Index. The Save Rural Hospitals Act that's been filed, I think, would help solve that. When 80+% of the counties in the country are below the index of 1, clearly there's an imbalance, and that imbalance keeps rural hospitals from being able to compensate their nurses in a competitive way with the larger neighboring counties where the wage index is higher. To me, that's the first thing that ought to be done.
Thank you for illuminating that imbalance, because we certainly see that throughout my district in Pennsylvania. Madam Chair, thank you, and I yield the balance of my time.